Did you know that the fourth leading cause of death worldwide is adverse drug reactions? It is the fourth leading cause of death worldwide. So years ago, I decided to write a book called Side Effects to address that issue, because I saw a lot of my patients who came into my practice, and they were having side effects from the medications they were taking. And I asked, well, why are you taking this medication? And why are you taking that medication? And many of them were told, well, they're taking them because the doctor prescribed it. I was having pain. I said, okay. Did you ever discuss where that pain is coming from? And so the book was born out of the idea of educating my patients. And I wanted to read a few facts and separate them from fiction from my book. And I won't bore you, but I'll go through a couple of things here. By the way, the name of the book is Side Effects, The Hidden Agenda of the Pharmaceutical Drug Cartel. Okay, so here's a fact. There are top 10 pharmaceutical industries in the world. Johnson & Johnson is number 1, and Pfizer is number 2. Now here's a fact. Pfizer spends $17 billion a year on advertising. Here's another fact. There are 675 pharmaceutical lobbyists there to make sure that the pharmaceutical industry is protected. It is the number 1 industry in the United States. And so when we look at this, there's a lot of political connections, and there's a lot of motivation for getting people to take certain medications. Now, I'm not saying all medications are bad, but there are a lot of unnecessary people or unnecessary medications that people are taking. For instance, here's a fact. The average American over the age of 75 takes more than 11 drugs. That's a fact. Fact, more and more potential new drugs are in development for the elderly. Fact, primary care physicians account for 35% of the prescriptions. Fact, 3 of the top 10 drugs for the elderly are medications used to treat moods and depressions. And let us repeat the already established facts, and that is the elderly are the largest group of prescription drug consumers. The cost of drugs to the elderly is increasing faster than the rate of inflation. It is expected to maintain this increase. That's a fact. Another fact, efforts to control prescription drug costs have not been successful. Those are the facts, or some of the facts. You know, there's a lot of people, for instance, taking antibiotics. And here's another fact. Antibiotics don't work for viral infections. That's a fact. Half of all the antibiotics, up to 90% of all antibiotics administered, prescribed, are unnecessary. That's a fact. The overuse of antibiotics can cause bacteria to mutate so that antibiotics no longer work in the end. And we're seeing more and more of this. We see this in the cattle. We're seeing this in the chickens. We're seeing them being fed large doses of antibiotics and developing antibiotic-resistant strains, superbugs, so to speak, that we can end up getting, like MRSA. That's just a fact that we're seeing more and more of that in the hospitals. And that's not a good thing. In the chiropractic profession, we like to get to the root of a problem. We don't like to cover it up. We like to find out where the problem's coming from. I enjoy that. I enjoy that because we actually have solutions to those problems. We're not covering up the symptoms, we're actually fixing the problem. When you get on a medication that isn't necessarily needed, you can become dependent on it, you can have side effects from it, and you can have the reactions from those side effects. For instance, there was a myth years ago that if you are osteoporotic, or in other words, you have osteoporosis, the best thing to do is go out and get some Tums. It's a cheap form of calcium. Well, the interesting part is the British Medical Journal came out with an article on that said, hey, Tums is an antacid, and you need acids in the stomach to break calcium down. So there are better forms of calcium out there than taking cheap forms, and that have a better action as far as your body using them. That's just one example on antibiotics. Another fact, Japan used to have one of the highest infant mortality rates in the world. That's a fact. The fact is, Japan decided that they weren't going to immunize their children until they're 2 years of age. And guess what? They have one of the best in the world now. We should learn from that, but we don't, unfortunately. There's a lot of political motivation, there's a lot of money motivation. So, know what you're taking and why you're taking it. Question it. You have that right as a patient. You can ask, what are the side effects? what can I do to make a difference? Or what are my alternatives? You know, when it comes to pain control, find out why you're having the pain. If it's coming to a dietary problem and you're taking Prilosec, for instance, for acid reflux, and it's really because you're drinking lots of Coke and smoking lots of cigarettes and drinking lots of acidic products, and you need to alkalize your diet more by eating more greens and healthier, that'd be a better solution than taking something that could potentially cause, and does, osteoporosis. That's a fact. It's not fiction. So, what I'm trying to say is take responsibility for your health. You have that choice. You as a patient can make it or break it. You have as a patient, there's a saying, are you sick and tired of being sick and tired? Well, yeah. Can you do something about it? Yeah. As I was saying before, doctors are not gods. We're not demigods. We're just human. We try to make the best decision and the best approaches we can. But you have the right to question. You have the right to say, okay, you want to put me, you're having an irregular heartbeat and you want to put me on a beta blocker or an ACE inhibitor. That actually happened to me a few years ago. I had a minor case of sleep apnea. And I went to the doc, and the doc said, hey, I want you to go see a cardiologist right away. Okay, so I went and saw the cardiologist, and the first thing he said is, I want you to take an aspirin. Do you have any problem taking an aspirin? I said, no, until we do the testing. He immediately came out with a beta blocker. And I don't know what he was thinking, but I can tell you a beta blocker has a list of side effects about yay big. And I actually found the root of the problem. I lost a little weight. I changed my sleeping position. Sleep apnea disappeared. So you get to the root of the problem, it's a lot better than finding yourself getting on a drug that could potentially, and actually the worst potential is death. The fourth leading cause of death worldwide, adverse drug reaction. You don't want that. You want to take responsibility for what you're taking. And when I talk about adverse drug reactions, that doesn't even include what happens when you drink alcohol or smoke cigarettes or take other herbal remedies. All these things can interact and create an effect. So it's really important that you take control of your condition and understand what's going on and what your choices are. If you want more information about my book, you can go to Amazon.com or you can go to my website. And here's another fact about your health, and that is, in the United States, we rank 37th in the world according to the World Health Organization as far as healthcare. We are not number one. As far as healthy life expectancy, we rank number 24. That's a fact. Another fact, 80% of the world population uses alternative medicine. 80%. It's a lot of people. And so take control of your life. Talk to your chiropractor about what your alternatives and what your choices are when it comes to how you eat and what you take as far as medications or supplements, and get their take on it. And if you do this, and when you do this, you will find that you will be living a much happier, healthier life with a lot more quality and quantity. And that's going to be a big difference on how you feel long term.